For about 60 years, warfarin has been prescribed as the anticoagulant of choice in arterial fibrillation patients. Anticoagulant therapy reduces the risk of harmful blood clots. However, warfarin patients would agree that warfarin requires frequent clinical visits and blood draws for INR monitoring. With recent advances in anticoagulant therapy, novel oral anticoagulants such as Dabigat, apixaban, etc. have come into the picture, which have the same effectiveness as warfarin. New oral anticoagulants are also known to be more patient-compliant. How, you ask? Let's find out. Warfarin has a narrow therapeutic index, which is why frequent INR monitoring is required in order to supply effective dosing. In case of rise or fall of INR, warfarin can cause bleeding disorders that may be life-threatening. NOACs, on the other hand, have broader therapeutic index and do not require frequent dose monitoring. So, all the clinic hours and painful pricks can be avoided with use of NOACs such as Dabigat, which shall add more time in the patient's day for themselves and their family. The mechanism of anticoagulant action of warfarin is dependent on inhibiting vitamin K-based activation of thrombosis factors. But with that, warfarin is also known to react with food and other drugs. Normally, green leafy vegetables, a rich source of vitamin K, are emphasized to be included in our diet. However, in warfarin patients, dietary vitamin K can actually reduce the effect of warfarin and lead to clotting incidents. In comparison, Dabigat acts directly on the thrombin enzyme, which is why it is not affected by dietary factors. Warfarin is metabolized by the cytochrome enzymes, which are also responsible for metabolism of other drugs. So, in case of taking medications such as NSAIDs, paracetamol, or antibiotics, the drug can alter warfarin metabolism. Fruit juices are also cautioned in warfarin patients for the same reason. Slowing down the warfarin metabolism may enhance time of action in patients, which can lead to hemorrhagic events. Dabigat, on the other hand, has no significant drug-related side effects. However, till now, where warfarin used to be the only option, we now have Dabigat. In NOACs, only Dabigat has a suitable antidote that can reverse bleeding complications. Hence, among the new oral anticoagulants, Dabigat is the safest therapy for the patient. Clinical efficacy of Dabigat has been found to be equivalent to that of warfarin, which means that in case of Dabigat, the patient will be equally protected. It is clear that replacing warfarin treatment with Dabigat will be beneficial for the patient. Dabigat doesn't need PT-INR monitoring and is available in an oral form to be taken twice a day, thus providing stable dosing for patients. This is not possible with warfarin as doses need modification from patient to patient in the case of warfarin. Imagine that, just twice a day, and the patient can lead a normal routine. The only concern with Dabigat could be the cost of the drug. But with the arrival of Dabigat in the Indian market, the prices have been reduced, the cost of which can be easily accepted by the prescribing health practitioners as well as the patients. In conclusion, Dabigat therapy will be a life-changing step for warfarin patients with protection and superior control. Introducing Dabigat, international quality at a national price.